So good evening all. Now I am going to share you 3 papers which have a case study. You can choose your case study, just read the case study and please loudly say what is the case study is about. Everyone, we are going to discuss about what is the condition. Okay? First case. If you want to change the case study, you can change it. Can you read it louder?
A 51-year-old woman undergoing hemodialysis developed acute respiratory disease, pH 7.74, PCO2 18 mmHg, HCO3 24.4 ml. What treatment can be prescribed to normalize respiration?
Okay, so the case study is about a 51-year-old woman. She is undergoing hemodialysis. That means she is a kidney patient. She is a kidney failure patient. But on the time of dialysis, she developed an acute respiratory disease. That means shortness of breath or water. Now the pH is 7.74, PCO2 18 and bicarbonate of 24.4. Okay. What is your case study?
A 67-year-old male with chronic lung disease presented by emergency room with shortness of breath, fatigue. Their ABG hypothesis pH 7.30, PCO2 55 mmHg, PCO3 60 mmHg, HCO3 34 MEq by that. The start of the ventilation.
So which case study shall we go this case study? So what is the pH? 7.3. What is the normal pH?
7.35 to 7.45.
So this pH is low. That means acidosis or alkalosis? The pH is low, it is acidosis. The patient is having a shortness of breath and chronic lung disease. So here her respiratory tract has been failure. What is the normal PCO2 level? 35 to 45 mmHg. So here the PCO2 is higher. When pH decreases, PCO2 increases. What is the condition? When pH is decreased and PCO2 is increased. When pH is decreased, it automatically comes under acidosis. So we are talking about PCO2. It is higher. That means respiratory acidosis. Why I am saying this is respiratory acidosis? When pH is less. So it is acidosis. Why we are saying this is a respiratory disease? The patient is having lung disease. So respiratory. Okay. And the PCO2 level is high. You can see the bicarbonate level, which is 34 milliequivalent. What is the normal value of bicarbonate? 28. So it is higher. This indicates a compensatory increase in bicarbonate level because of respiratory disorder. So what he was started with ventilation. What happens when we give oxygen to the patient? Whenever you give an oxygen to the patient, the CO2 will be removed. Okay, so the bicarbonate and the PCO2 level will come to normal. Okay, because the CO2 will go out. What is this condition of case study is about? Is it respiratory acidosis? Okay, come to this case study. A 51-year-old woman undergoing hemodialysis. That means she already having a kidney disorder. And the time she have acute respiratory disease also. So pH 7.74. What is the normal pH? 7.74. So 7.4 indicates increase. That means acidosis or alkalosis? Alkalosis. Right. It is alkalosis. What is the bicarbonate level? Normal. 22 to 28. So it is at the same range. It is 24.4. What is the change here is PCO2. PCO2 is 18 mmHg. So decreased PCO2 and increased pH indicates. No, here bicarbonate is not. So whenever there is no change in bicarbonate, we should not say it as a metabolic. It is an PCO2 is very less. So the patient needs her own PCO2. So what treatment can be prescribed? Whenever there is, you cannot give oxygenation because already the patient is having less amount of CO2. So what can be given as? She can give a mouth breathing on the back. So I have already said, give a mouth breathing on the back. The CO2 goes to the back and it returns back to yourself. So the mouth breathing is the treatment for this condition. Okay. Here the PCO2 is higher, so it is alkalosis, and the PCO2 is lower, it is respiratory, and pH is higher, it is alkalosis. This is respiratory alkalosis. So the first case study we see about respiratory acidosis, and the second case study is about respiratory alkalosis. It is about a third case study, which I will study. A patient presented with pH of 7.52. pH is high. Bicarbonate is 34 milliequivalent per liter. 34 milliequivalent per liter. Bicarbonate. It is higher or not? Higher. Potassium is 3 milliequivalent and she has excessive vomiting. The condition is excessive vomiting. Here I am talking only about bicarbonate, not PCO2. So what is this condition? Metabolic. Acidosis or alkalosis? No, the pH is 7.5. Alkalosis. And bicarbonate is 34. So it is metabolic alkalosis because she has an excessive vomiting. So what is the treatment that can be prescribed? So you want to control the vomiting sensation. So the tablet will be given, and they have excessive vomiting means the patient will have dehydration. So you can give glucose treatment as an alternative. And here the potassium level is also mentioned. I will say the normal values tomorrow. We can discuss what is the potassium normal value and why it is decreased. Okay. Here the pH is 7.52. So it is alkalosis, and the bicarbonate is also higher, and the patient is having excessive vomiting, which comes under metabolic factor. There is no respiratory condition given to this patient. So it is not respiratory. It is metabolic. Have you understood this? Yes. Tomorrow I want you guys to discuss the same with other members. You want to leave the sheet today. You want to ask the question in the classroom. Right? What is this condition? They want to explain. Okay. Thank you.
Thank you, ma'am.